move forward, our last discussion, I would say a chat. So this fireside chat on transformation, healthcare procurement and building technology-driven supply chain resilience. The topic of the theme is transforming healthcare procurement towards resilient and technology-driven supply chains. May I have our esteemed persons, the eminent speakers, to please come on the stage for this. And the moderator of the fireside session is Mr. Vikas Goyal, Head Supply Chain Management, Fortis Memorial Institute. Along with him, there will be Sonu Kumar Yadav, sir, founder and CEO of hospitalstore.com, a healthcare procurement and supply chain platform. Can we have a round of applause for Sonu, sir, who is always a big supporter to Medgate today with his humbleness, support, and many more love. The last one which we have, but not the least, Mr. Amin Jahid. He is the healthcare consultant at Octavo Solutions Private Limited. Now the charge is on the moderator. Can we have him on the dais, please?
Thank you, Ritika. So good afternoon all. Welcome to this last session, which is fireside on supply chain on infrastructure related. So myself, Vikas, so it's my privilege and honor to welcome to all of you on this HPIE conference, 5th edition, New Delhi. So healthcare infrastructure today is no longer defined by the building, beds, people, medical technology. So increasingly the strength of a healthcare institution is being measured by the resilience, intelligence and agility of the supply chain also. If we see from the financial point of view, around 40% of the consumption and 40% of the revenue goes for the supply chain management for the hospital. That's why it's so important and critical from a finance point of view as well. Over the past few years, healthcare organizations across the world have seen increasingly disruptions. Pandemic, lockdown, geopolitical instability, inflation pressure, shortage of the critical medical equipments, lockdown of the factories and companies, shortage of the raw material across the globe, and rapidly changing the patient demand as well. So these events expose vulnerability with traditional procurement models and escalated the needs of digital, integrated, collaborative, clinical aligned, future-ready supply chain. Traditionally, procurement was viewed primarily as a transactional and operational support function, focused on sourcing and cost management, just to procure and reduce the cost for the hospital. However, now the new scenario, the healthcare landscape has fundamentally changed, where we have to focus more on patient care continuity, clinical outcome, operational efficiencies, financial stability, risk management, risk mitigation, and institutional resilience. So as a hospital move forward smarter healthcare infrastructure technology using the artificial intelligence, RFID systems, inventory tracking systems, hospital softwares and HIS in the hospitals, integrating the OPD, IPD, patient care, financials and administrative in the systems across the hospital. So at the same time, healthcare leaders must carefully balance cost optimizations without controlling the quality, efficient with resilience, standardizations with clinical practices, and innovations with sustainability. So on the same, I look forward to an engaging discussions and fireside with my colleague panelists. So I just start with the communications, how healthcare procurement is evolving, what technology will shape future supply chain, and how hospital can strengthen the resilience, and how procurement leaders can become strategic contribution to healthcare transformation. So let's start. Sonu. So in view, how has the healthcare procurement evolved from an operational support function to a strategic pillar within the hospital infrastructure?
Hi, my name is Sonu Kumar. I am founder and CEO of hospitalstore.com. Healthcare supply chain has evolved from the last decade, and earlier it was considered as a back-end operations, but now we considered it the main strategic pillar of the hospital healthcare operations. And I would say especially after the COVID-19 pandemic, we have seen that COVID-19 has exposed vulnerabilities in the global healthcare supply chain, and now hospitals are taking it very seriously. They are investing more in the new technology-driven solutions, and that's why we see more visibility in the healthcare supply chain. more platforms like hospitalstore.com, and we are making medical equipments more accessible, affordable for the healthcare, and more than 27,000 products available on the platform. This type of technologies are helping hospitals to procure smartly. Hospitals equipments are more affordable. Another, I think, changes is happening is the everyone is optimizing for the speed nowadays, right? And in our everybody in our personal life also, we experience all these quick e-commerce solutions like we use Swiggy, Zepto, right, Instamart, and in the same way, healthcare hospitals also need to optimize for the speed, because patients also have similar kind of expectations where they can get the healthcare delivery as soon as possible. So, and the technology also moving in this direction. I see in the future, hospitals will invest more on the healthcare supply chain. It is going forward, it is going to be main strategic pillar of the healthcare procurement, going to be strategic pillar and not the back-end operations.
Right. So rightly said, Sonu. So these are the important part which we have to consider in planning the hospitals and running the operational part for the hospital. So so you are as a consultant, so what's your insights on the same for the hospital industries and the healthcare leaders?
Hello. Yeah, so basically, supply chain, there has been a shift from just it being a back-end operation to being the main strategic pillar for clinical decision making. As in hospitals, due to poor supply chain management, there can be a lot of failures, like surgeries can get delayed. Even if reagents are not available, diagnostic tests cannot be done in a proper manner, in a proper standardization. So hospital supply chain just being the back-end operation that it used to be, it has now been a main heart towards the patient-centric care, and it does boost the patient care and the clinical decision making also. Nowadays, in many hospitals also, the shift has been seen in most of the metro hospitals, and in many of the non-metro hospitals, there are smaller hospitals that are running. Unless this shift comes into all the hospitals, that is being like focused, not only focused on the cost aspect, but also on the patient care aspect. Like until and unless the procurement team and the back-end team also thinks about how we can not just save cost on this, and how our better procurement and better efficient clinical decision making can also save people's life and also can reduce hospitals' cost while saving people's life, that will be more beneficial.
Right. So just to add from the Fortis, what we are considering in the procurement part in the last 5 years and what the projection we have for the next 5 years, like strategic importance of the procurement. So involving the procurement department from the decision making, starting initiating any projects, any new specialty, adding the bed in the hospital, so that all the key features, latest technology, designs, cost, etc., budgeting, etc., that has to be taken on the initial phase rather than they are going for the haywire later on. Second, supply chain as a business continuity drive, because we continue need the material, perishable material, renewable materials, direct to hospital and direct to hospitals. So continuity of the supplies is
what the doctor is usually prescribing, what the usual pattern of the supplies has been. So the main challenge that remains is the interoperability. Unless these systems, they talk to each other in a defined and standardized manner. And second of all, healthcare literacy. Most people, they know how to use these systems, but most of them are from non-technical background and also from a non-clinical background also. And they have a poor health literacy about knowing these healthcare terms. And that causes a major delay and also many setbacks during these procurement operations.
Okay, great. So Sonu, just to follow up question with you on the same, because you are handling our largest stores and supplying to multiple locations in Delhi, NCR, even outside Delhi as well. So do you believe AI and automation will replace traditional procurement roles or primarily enhance strategic decision making and giving the cost-effective benefits to the patient as well as to the business to business?
Yes, AI definitely going to benefit the hospitals in different perspectives, but definitely it will not replace the healthcare supply chain entirely. Okay, it will not replace the healthcare procurement teams in the hospital, because healthcare procurement teams that profession is based on more decision making, right? Comparison with the products, maintain a good relationship with the suppliers. AI will not replace directly to them, but it will elevate and enhance the role in the future, like creating the quotations. It can be like purchase orders. It can be done through the AI.
So that means our jobs are safe.
Yeah, for the supply chain, because it is lot of decision making there, and definitely it will going to help somewhere the procurement teams in the future.
Yeah. So definitely say so. We also look forward as a AI as a decision support system. So help us to take a better decision for the organization point of view, whether
Definitely,
financial,
definitely.
whether quality, or whether about the availability of the products in the hospital.
Yes, AI in the future, based on the data and consumption pattern, can give the predictive analytics for the inventory, like how many stocks they need to purchase, what is going to expire, so that hospitals can manage the overstocking and they can manage the short supply for the goods. Definitely in this AI going to help in the fuure.
Yeah, truly said. So in a supply chain, if we see in a hospitals, so it's one of the hectic department, and we have seen a lot of human oversights also. Timely, not.
Can I add something into this?
Yeah, please.
Yeah, so as Mr. Sonu said, AI cannot replace everyone, but I believe that a person who knows better how to use the AI can replace it.
Yeah, great. So we see in a hospital there are a lot of oversights, repetitive procedures, same day PR, PO, GRN, demand, supplies, receiving, etc. So definitely the AI, the tools, latest tool, help us to reduce this repeated nature, increasing the efficiencies and reducing the turnaround time from procurement to end user supplies in the hospital.
Yes, definitely. Repeated tasks can be done in the more efficient manner with the help of AI. So a model can be trained for the repeated tasks. So then definitely AI will handle in the future.
Yeah. So my next question is, how can the hospital build supply chain that are both cost effective and resilient during this disruption time also?
The main thing that I'll say is the hospitals need to change their procurement from cost-centric to patient-centric. Traditionally, the traditional way of measuring the outcomes for a procurement is to asking yourself the outcome question is how much money were we able to save, rather than asking yourself that how much cost based on patient lives you are able to save.
True. So Sonu, you would like to add?
Supply chain is very important for any hospital, because it's directly, it is not like I said back-end operation, it directly impact the patient care. Hospital operational efficiency, right? And hospital compliance. In this way, supply chain, I think, going to help the hospitals in the future with the help of technology and the decision predictive-based analysis.
Yeah, truly said. So if we see in a hospital in a supply chain, the supply chain interact not only with the internal customers like doctor, nurses, technicians, paramedical staff, patients as well. They have to interact with the external customers like manufacturers, supplier, marketing company, medical representative, medical devices company manufacturers, discussing about the technical aspects, commercial aspects, techno-commercial aspects over there. So the tools which help us to reduce their daily burden, repeated nature of job, that is very much essential. So that hence their productivity will increase and they can more focus on the productive work rather than just the repetitive documentary work. So on the same way, we see how we can maintain the balanced inventory model, strategic partnership, risk segmentation, and scenario planning that we also think from the point of view on the AI point of view. So now Sonu, specific for you because you are handling a lot of supply chains, stores, consolidator, aggregator SO. So healthcare is a price sensitive market. So now the people are also doing the window shopping. Patient is also checking the prices on the different hospitals for a certain non-emergency procedures in the hospital. So price sensitivity in a healthcare is increasing significantly. How can the procurement leaders optimize cost without compromising the quality, safety, and patient outcome?
Price sensitivity is increasing through the, I would say, the entire healthcare ecosystem, not only for the hospital, like for the patients and for the insurance companies and for healthcare providers. And hospitals should not focus only on the purchasing the lowest cost product. Instead, they should focus on the value-based procurement, where they can compare the product value during the entire life cycle of the product. Sometimes, cheaper product may cost higher in the later on, where the hospital need to pay high amount of amount for the service, for the accessories, for number of breakdowns. So hospitals, they can compare the price for the entire life cycle of the product, and hospitals need to have more suppliers. They should not only have like 10 to 12 or 15 suppliers. After the COVID pandemic, we have seen that we should have the contact of our suppliers of suppliers, okay? And where, whenever required, we can negotiate, we can purchase from, if it is not available with one supplier, we can talk to the other supplier. In this way, we can negotiate, we can compare, and we can do the discovery and reduce the cost in the supply chain.
Yeah, rightly said, Sonu. So I just second the same, what the thoughts you have put. So value-based procurement is very important for the hospital, rather than just going for the cost basis. Strategic sourcing is also, we have to have a different vendors in different regions, backup of the backup so that we can handle the emergencies in the hospital. Product benchmarking, standardizations, and variety reduction. That is also very important, which give us the value addition and cost reductions also. So keeping the multiple brands for the drugs in a same pharmacy, and just to restrict to 2 or 3, which is approved as per the hospital formulary, give a lot of advantage to the hospital and reduces the non-moving, inventory management, surplus, etc. That also reduces the burden on that point of view, which is the dead stocks in the hospital later on. And wastage reduction. So all this activity will help us to reduce the wastage in the hospital also, which is not for the loss for the hospital as well as for the society also, and impacting on the sustainability part for the country. So, just coming to you on the same. So, do you foresee procurement KPIs? Because we're talking about the KPIs, key performance indicators, and the merits and demerits of the systems, data, tools, reports which you are presenting to the management. So, how KPI involving beyond traditional saving metrics, and what all metrics we have to add besides the savings, so that we can highlight the value addition from the supply chain point of view?
KPIs are basically the most effective way to measure how your supply chain is doing and how your hospital is basically functioning. Even during auditing phase, the KPIs are the most that's been seen. It is like a metric for your hospital, how your hospital has been performing over the years and over the months, and how you plan to make it better. So traditionally, what the way of measuring KPIs is on the outcomes of patients and on the outcomes of supplies used. I believe there could be a shift to a more efficient based measurement for the supplies. For example, like if a surgery is delayed due to a supply not available or a drug not available at that time, so we can shift to measures such as how many surgeries that could have been postponed we were able to do in a specific period of time due to our efficient supply chain management and so on. So just like these metrics, we would be able to process and we would be able to measure how our hospital department is functioning over the past months and the past years and how we can better forecast it for the future.
Yeah, sure. Sonu would like to add because you are maintaining a lot of inventories also.
Yes. KPI is not just only important for healthcare procurement. KPI is important for entire organization, right? And in the healthcare procurement perspective, if I say, hospital definitely need to track some important KPIs. Like one I would say overstocking and inventory, high inventory can break any hospital, right? And expired stock they need to monitor properly, and how much time one item it is taking, what is the time for one item to procure in the hospital, right? So all these KPIs are very important for any healthcare procurement model.
Yeah, so truly, Soina, just to share my examples of the Fortis, so all these parameters like what is my inventory days, what is my fill rate, how many suppliers have supplies the material, what are the non-PO supplies material in the hospital, expiry stock, non-moving stocks, non-available stocks, new additions which in the hospital have done, turnaround time for issuing the materials to the in OPD pharmacies and IPD pharmacies. So these are the important parameters which we are monitoring from the so many years. But now seeing the change, the technology use, we have added some value addition parameters also, like outcome-based procurement. Whatever the procurement we have done, what the value addition we have done for the organization in point of view increasing the revenue or reducing the cost, increasing the EBITDA, and availability metrics. How much material, how soon it's available, how we are able to shorten the lead time of supplies. Earlier we are purchasing the material for the 15 days, 1 month, now 7 days. Now come the concept of GIT, just in technique, or just in case is required. Like all of BMI items, the patient customized items are coming on the order base in the hospital. Clinical effectiveness, what the material we are buying, what the clinical effectiveness is done. My infection rates are reducing by using these infection materials in the hospital. How my PPEs are effective. How much the preventions they are doing for my staff from the regular infections in the hospital. So these monitors the material outcome and their material quality impact as well. Besides this, we added the inventory optimization and sustainability factors also. How much the material which we are buying is economically and environmentally and safe for the hospital. And how much the material we are using, we can reuse, reduce or recycle the waste after the uses in the hospitals. So these all parameters we have also added in our KPI, what we are monitoring from the supply chain point of view. So now move further. So what is the one major transformation healthcare supply chain you see we have to achieve before reaching the 2030?
I think I would suggest that hospital should consider the predictive analysis and forecasting for the inventory in the hospital in the before 2030. And it is hospital need to optimize the healthcare procurement with the latest technology, ERP system they should have inbuilt. They should bring more suppliers, should not depend on limited suppliers, so that they can reduce the cost. In this way, it will help the hospitals to reduce the procurement cost, and it is going to forward to the patient. It will make the entire healthcare affordable.
Sure. So, Amin, you want to add something?
Not basically, but as we all know that AI is the future, and of course, predictive analysis is the key for a better procurement. Like we should know if the systems inside our hospital can talk to each other. there will be a better understanding of how our hospital procurement is going to function in the nearby cycles, and what stocks could be overstocked, or what shortage could be done, what even if based on the disease load or the surgical load, if we can calculate this and we can predictively analyze it, even if there is 80 or 85% chance that we were right on point, it could help save a lot of money and also save lives.
Yeah, sure. So if we see in Fortis, so we have taken the target for the next 4 years to transform our supply chain, healthcare supply chain. One is green healthcare procurement. So whatever the procurement we have done, it's added to my green points, green scales. And in that, we have to look forward for the local suppliers, nearby suppliers, so that the transportation time reduces and they have to use the e-vehicles rather than petrol or diesels or the traditional fuel systems over there. And secondly, my waiting time is also reducing and the transportation cost is also reducing if you can do the local supplier based over there.
In this way, do you think hospitals like you are there in the future? They are considering more in the quick commerce model from the nearby, like Zepto and all these. They are delivering the goods.
So basically, these all are the online channels, online platforms. So we are just evaluating how they can fit in our commercial terms in the hospital, because the commercial terms as a business to business in the hospital is different rather than for the customers. But definitely, if they are providing the quality material as per the terms and conditions, which is mutually agreed and beneficial for my patient, for my doctors, as well as for the environment, they are giving the preference.
Understood.
And secondly, the important part we have seen even in our hospitals is intelligent inventory ecosystems. So sometimes we feel the stock is available, the information is not reaches to the right people, like ICU team, OT teams over there, before planning the surgeries or during the surgeries over there. So we have an intelligent inventory system, so everyone can trace the item in the hospital anytime, how much is the quantities available, what is their batch size, and how much is distributed in the hospitals over there. So it saves a lot of time to channelize the items in the hospital and is easily available and retrievable for the users in the hospital. So now we come on because it's a healthcare infrastructure part. So and we have a lot of AI. We are using a software also. We have the cost constraints also for the Tier B and Tier C cities also, and the new upcoming hospitals which are single specialty or the smaller bed hospitals. So how can the mid-size hospital adopt the digital procurement benefits of the AI systems or the software HIS with their limited capacity to invest in this system?
Hospitals, small hospitals, I think, they can focus on buying the hospital management system. Nowadays, procurement, inventory management, all comes integrated with the hospital management system. And in the future, AI definitely going to help the healthcare procurement. And in this way, it will reduce the cost. With the help of HMS, they can put all the suppliers' data centralized in the system. They can have the inventory centralized in the system. They can monitor the overstocking. They can check which products going to expire in the soon future. Initially, maybe it would cost something to the hospital, but in the long term, definitely it will going to help the hospital to reduce the cost, and it will help the hospital to bring the more efficient infrastructure that is going to deliver the care to the patients in the long term.
Yeah, sure. So, I just see because you are from the consulting firm, you're doing a lot of consultants on the NABH, JCI, hospital setup, greenfield, brownfield projects. So what's your suggestion and advice for the Tier B, Tier C hospitals so that they can use these consulting services on the various platforms and they can get the better quality and on the reduced rates?
They should not just focus on the cost itself. Initially, these softwares can cost a lot and are very expensive even to install. And that does not even include the training. Like you have to provide training to the staff there on using the software, how to use it correctly. You have to teach them, you have to train them. It takes a lot of time and it costs a lot of money also. So, but in the long run, it is always effective. It is always effective to integrate such softwares, to integrate such HMIS that are integrated with each other, that have all the functionalities. They can talk to each other, every person knows everything, and I think in the small hospitals it is very easy for the people around there to get an insight of everything. So in the long run, it will always be cost effective. If we just think about the cost from the first perspective, then it won't solve the long issue. But of course, it can solve the care outcome and also the patient care in the long run in the going future.
So truly said. So if we see the future of healthcare infrastructure will depend significantly on an intelligent supply chain ecosystem, because smarter procurement is smarter care. So if the hospital have a good procurement systems, good materials, good selection criteria in the hospitals, timely availability, definitely they will boost up the clinical outcome for the clinician team over there. So just to see, because time is over, so what's your closing remarks on the same?
I would like to say in the closing, in one line, nowadays hospital procurement is not just a back-end operation, it is the main strategic pillar of the healthcare supply chain, and hospitals are investing on these latest technology-based solutions like ERP, I said, or inventory management system, and this is going to help the hospital in the future. Like from the last 2 days, we have been doing all this discussion, planning, infra, right? This is not going to deliver without a efficient supply chain, right? So hospital definitely consider this, and they will invest on these smart solutions.
Great. So Amin, from your side?
Supply chain is definitely the main one of the main critical aspects for hospital operations. You cannot just simply rely on manpower without any supplies or consumables in a hospital, and if the supplies are not available on the right time and to the right patient and in the right quantity, it will always cause a problem in the upcoming future and will always bear a burden on the hospital itself and also on its reputation.
Great. So one of the strongest takeaway for me from the today's session is that future of healthcare is not depend only on infrastructure, will not depend only on advanced medical technology and clinical excellences, but equally on the intelligence and resilience of the supply chain support system in a hospital. So as a procurement leader, the opportunity is with us to move beyond transactional purchasing and become strategic contributor to the healthcare transformation, institutional growth, and good healthcare delivery for the public. So I sincerely thank all the esteemed panelists, delegates, and the organizers of this Healthcare Planning and Infrastructure Conference 5th edition, New Delhi, for this excellent platform to discuss, to advocacy, and to represent our thoughts on these meaningful discussions. So it has been always been a privilege to me to moderate this session. Thank you and look forward. Thank you.
Thank you so much, sir. And you people had a very, very, very dynamic fireside chat talking about the procurement and supply chain and how important it is for the hospital and for bringing the equipment and the necessary things into the dais, into the desk, on the table for the hospital. So moving forward, I would request Mr. Afzal Kamal to please come on the stage to felicitate our fireside chat, self-reliant, technology-driven supply chain in the hospital. And it is always wonderful to have Vikas sir, Sonu sir. Can we have a big round of applause for him as well? He is one of the younger person who